From the moment they are born to the day they graduate high school, regular health care is a critical part of a child's physical and mental well-being. Experts agree early and consistent pediatric care doesn't just treat illnesses, it builds lifelong wellness. In fact, in today's ever-changing world, regular health care throughout our childhood is more important than ever in order for children to reach their full potential, physically, socially, and mentally. Pediatrician Dr. Adam Breslow explains.
Regular health care is so important because children are universally considered to be the greatest gifts of families. And as we take care of kids from their infancy, their newborn period, we screen them for metabolic and genetic disorders. As they grow older throughout infancy, we screen them for developmental and behavioral concerns as well as their physical growth. As they get older, we screen kids for developmental and behavioral disorders. And then as they get older, even through adolescence, we screen them for mental health concerns. By doing that and developing trust with families, we can then either cure things right away, we can refer them for early intervention for improvement, or we can refer to our specialty colleagues if we can't help. In that way, we treat the whole child. Children are facing challenges that really have never happened before. And with that, besides all the physical concerns, we're really much more attuned to their behavioral and mental health concerns like never before. And it's mission critical, and our mission is to raise the healthiest children into adulthood. You can't be healthy with just physical health. You have to be a whole child healthy. You have to be healthy physically, mentally, emotionally, scholastically, as part of society. So that's our mission, to raise the healthiest kids in a holistic manner.
Here in San Diego, Dr. Breslow and his team of healthcare practitioners at Children's Primary Care Medical Group have dedicated themselves to advocating for the importance of providing consistent and complete care for children of all ages. As the region's largest medical group specializing in care just for kids from birth to age 18, CPCMG has seen children's needs change over the last 30 years and has responded with a more holistic, team-based approach to care that helps children stay mentally and physically healthy.
CPCMG, Children's Primary Care Medical Group, really came together in 1995 as an idea of how do we get different primary care pediatric offices to come together to provide more comprehensive care to our children across the county. And with that, over time, what we've seen is a move towards more whole child care. So whatever is coming in the office is what we as pediatricians can help take care of.
When I first started coming to CPCMG, my third son, he'd had a lot of behaviors that were very different from my other children. And I had never had a doctor that kind of honed in on him and tried to help me understand him. And that is the greatest thing about CPCMG, is that this child is operating through a different lens. And I don't know, without CPCMG, if we would have figured out all of his diagnoses and been able to give him the care that he's getting now.
One of the things we've done is to have all of our clinicians, MDs, DOs, NPs, PAs, go through very specific training to learn more about what we call the big three: ADHD, anxiety, depression. CPCMG is so dedicated to having behavioral mental health really part of the fabric of our organization. Every new hire goes through this very specific training within 6 months of hire. Whatever the question is, you can come through our doors and knowing you're getting the correct care at the correct time for the correct kid.
Having the word autism thrown at me with a young kid was pretty overwhelming, and I wondered, like, is my kid gonna be okay? And having the doctor and the resources that could help me, I remember the day that Dr. Bowers hugged me and said, Zeke, he's just gonna be himself, and we're gonna get through this, and we're giving him all the tools that he's gonna need to be successful in life. And that just gives a mom such a peace of mind. There's so much hope for these kids to get the help that they need.
The landscape of pediatrics is constantly changing. These checkups, we are using evidence-based screening tools to make sure your child's meeting their developmental milestones, whether that be speech, gross motor, fine motor, or social and emotional development, and that includes screening for autism too. When we're providing advice to our patients at well visits, we're also making sure that we're most up to date on the changing landscape. And so that includes advising on solid food introduction for allergy prevention, as well as advising parents on limits of media use and screen time. When you come in for a sick visit, our clinicians are using evidence-based clinical practice guidelines to make sure that we are doing our best job as primary care pediatricians to partner with the specialists in giving the best care in a primary care setting. We make sure that we have clinical practice guidelines, so we're providing consistent and excellent care. Then for our patients, we have a patient-facing health hub that we can direct our patients to so they can read about and learn about the most up-to-date recommendations on everything from breastfeeding, acne, and mental and behavioral health.
Having cared for more than 200,000 families since 1995, Children's Primary Care Medical Group is determined that all children have access to quality, consistent care, including the most vulnerable children in California. That's why the group works diligently to break through the barriers many underserved communities face to make sure every child receives the foundation for a healthy life.
Removing barriers to healthcare is a mission of CPCMG. It may come as a surprise to most people that 1 out of every 2 children in California is insured by Medicaid. And with that, it's very difficult in other healthcare systems. They do not accept Medicaid, so it's very hard in many communities to get care for their children. What happens at CPCMG is, say somebody has commercial health insurance and they lose that insurance for whatever reason, and they have to go on government health insurance, we can still see them. So we're a true medical home. And we have people with tears in their eyes when they know that they can still see their regular doctor even after they lose their health insurance.
Understanding that it takes a village in order to provide the care today's youth requires, Children's Primary Care Medical Group places a strong emphasis on clinician wellness to ensure that its pediatric team is strong in administering care to its fullest potential so that each child can reach theirs.
At CPCMG, we have a large commitment to clinician wellness. In preventing burnout, we can allow clinicians to really do what they do best, which is to care for our patients and our families. So some of the efforts that we're doing at CPCMG are to really do a few different things, including building community with each other so that we can care and support and give resources for each other, and also to build team efficiencies so that we can all do what we do best, which is to really focus on the health and care of our patients.
We're very proud of our holistic approach. Healthcare is in crisis. Families are in crisis with access and mental health crisis. There's a clinician burnout crisis in this country, and even more, the staff burnout is even more than that. So what we've done is developed a new team-based approach to make sure that we take care of everybody, our patients and families, our clinicians, and our staff. We've really turned the dial on improving how we can give good care to patients, but keep everybody both physically and mentally healthy.
Children's Primary Care Medical Group. Peace of mind for parents. To find out more, please visit cpcmg.net.